How will public hospitals cope as the nation continues to ease COVID restrictions? Without more urgent funding, they simply won't. That's according to analysis by the nation's peak medical body. As political reporter Stephanie Dalzell explains, the Australian Medical Association has found that ICU demand will soar and there'll be longer waits for elective surgery.
Protecting our overstretched health system to save lives and prevent hospitals from being overwhelmed.
COVID's going to have an enormous impact on our hospitals' ability to deliver.
The AMA has analysed the impact of opening up on the public hospital system, looking at 3 scenarios. Its best case scenario used the same hospitalisations and viral behaviour as the Doherty Institute's model, which is guiding the nation's leaders in their pathway out of the pandemic. Its medium scenario assumed the same viral behaviour as what we've seen in the UK, adjusted for Australia's vaccine rate, while the worst case didn't factor in the nation's high vaccine levels. Under all scenarios, demand on public ICUs would increase within 12 months by about 7% under the best case, 20% under the medium and almost 50% under the worst. Emergency departments already at capacity would be further overloaded and elective surgery waitlists expanded, while between 400 to 2,400 of about 63,000 hospital beds would be permanently occupied by COVID-19 patients on an average day.
Once COVID comes in, the only way we can look after people with COVID is to stop looking after all the other people that we're currently looking after.
The modelling has landed in the middle of a bitter debate between the nation's leaders about who should pay for the health cost of easing restrictions. The states and territories are scared their hospitals won't cope as the nation emerges from lockdowns and borders reopen, and are calling on the federal government to pay half of public hospital costs for the next few years.
We have increased our funding by significantly more than the states and territories.
Doctors and nurses can't afford for Scott Morrison again to pretend this is all someone else's responsibility.
Public hospitals have become the latest casualty in the blame game between the nation's leaders. And with at least one state linking increased hospital funding with borders reopening, there's plenty at stake for the Commonwealth. Stephanie Dalzell, ABC News, Canberra.